Hi, how are you?
I'm
Hi.
good, how are you?
My name's Albert. I'm the student physical therapist.
And hello, my name is Anthony, and I'm the clinical instructor for Albert today, so I'll be observing him.
Okay.
So what brings you in today?
Oh yeah, I have pain in my right side of the neck and arm, and it keeps bothering me, and I feel a bit of a numbness down my arm and fingers.
Okay. What should I do?
Albert, can I talk to you for a second?
Yeah, sure.
You could go ahead and seat right here.
Okay.
I recommend you do lateral cervical glides. Do you recall the study that we went over last week about it?
Oh shoot, I don't. I need to go on load. Oh. I don't know if cervical lateral glides can help this patient. Let me try to recall that study my CI told me about.
This article studied the effects of cervical lateral glides on pain and functional mobility compared to a control group that received no treatment. The numeric pain rating scale was used as a primary outcome. The NPRS was significantly reduced in the cervical lateral glide group when compared to the waiting list control group. However, there was no significant changes in the NPRS score in the control group. The secondary outcomes that were utilized in this study are quick dash questionnaire and cervical range of motion measurements. Within the CLG group, there was significant changes in CROM and the quick dash scores, which indicates that there is a positive effect of CLG in increasing upper extremity function for patients with cervical pain.
Wow, so it seems like cervical lateral glides seem to help reduce pain and lead to better functional self-reported outcomes. But what about the effect size?
The effect size of the experiment was calculated with Cohen's d to compare the experimental group and control group. They used the three different outcomes to compare the effect size in 15-day increments of the experimental group. The NPRS scale showed a large effect size when comparing the pain values from day 1 to day 30 for the experimental group. The CROM tool showed a large effect size between day 1 and day 15. The quick dash showed a large effect size between day 1 and day 15 of assessment. Given all of this data, the experimental group showed a big treatment effect on patients with cervical brachial pain. There was a medium effect size of change among all three outcome measurements in the control group. This means that the treatment effect of the control group showed a difference, but it might not be significant enough of a difference to use as part of the treatment.
What about the parameters of variability?
This study reported low p-values and low standard deviations in all significant results, which indicates that the likelihood of error was insignificant and that the treatment effect was relatively consistent.
But what about threats to internal and external validity?
The first threat to internal validity was that although the patients were properly ruled in for neurogenic issues using the Sperling's test, cervical distraction test, and upper limb tension tests, the authors failed to exclude patients with musculoskeletal issues. Another threat to internal validity was the failure to record physical therapists' opinions on the effectiveness of cervical lateral glides in cervical brachial pain. Because most of the threats to internal validity were addressed by the authors, there is weak external validity. Therefore, generalization of the study results is limited to the population outlined in the inclusion criteria.
What about the strengths and weaknesses?
The weakness of this study is that the subjects were recruited on the basis of cervical pain with neurogenic origin, but does not rule out or exclude patients who have cervical pain from both neurogenic and musculoskeletal origin. Another weakness of this study, as noted by the author, is the lack of high-quality research related to cervical lateral glides and neuromobilizations in cervical pain. The strength of this study is that a large treatment effect was seen in using cervical lateral glides and neuromobilizations to treat cervicobrachial pain with 95% confidence. This effect size is trusted because most threats to internal validity were addressed with appropriate statistical analysis, blinding, and inclusion/exclusion criteria.
That does sound like a good study. Let's go with cervical lateral glides. like my CI suggested. Hey Anthony, so I actually do remember the study, and I think it would be a great idea. So it's okay if I do it?
Of course.
Okay. Okay, so we're gonna start the treatment. Are you ready?
Yeah.